This public service announcement is for the Arizona Department of Health. Compared to other demographic groups, African American women face the greatest risks when seeking care from healthcare professionals, whether they experience some type of complication or they end up succumbing to their illness or the procedure that they're receiving. To better understand why African American women suffer such tragic fates when going to get medical attention, I began to research on my topic and I identified three factors I found contributed to the issue. First is racial bias, access to healthcare, and lastly, the disregard for patients' concerns. Racial bias has been a theme associated with many people of color in this country for centuries. And especially in the healthcare field, this can affect the type of care that an individual can receive. African American women are viewed as these colonial stereotypes from slavery era America, such as like Jezebel and Mammy. Often they're over sexualized and their concerns are often brushed under the rug because there's that bias of before the healthcare professional even gets to know who they are. And as a healthcare professional, their job is to treat the patient and not pass any judgment. They have an oath to treat the sick to the best of their ability. So the second theme was access to healthcare. According to the Kaiser Family Foundation, premiums and deductibles are pushing employer-based coverage for employees out of reach as time goes on. The average premium paid by the employer and the employee for a family plan now tops $20,000 a year, with the worker contributing about $6,000. As time goes on, things get more expensive. Healthcare is expensive, and a lot of individuals in this country, with the jobs that they don't have employer-provided healthcare. So it's nice when you can go through your employer because they're able to get you a sort of like discount with these major companies. But if you're not lucky enough to where your employer provides that, then you're forced to seek out the private companies yourself, where it can be a lot more expensive and unaffordable for most individuals. And even then, if you can't afford it in your monthly budget, then you're forced to, if you don't have Medicaid, then you're forced to just live without insurance, which can be very costly, especially if you require a visit to the emergency room. You're going to be stuck with a bill, and there's not going to be an insurance company to cover a portion of it. My last theme was the disregard for patients' concerns. According to the Centers for Disease Control and Prevention, Black women in the United States are over 3 times more likely to die from pregnancy or child-related causes for childbirth. I think this was especially alarming to me, considering no matter the social standing, the amount of money you have, celebrity status, the African American women everywhere are under a great threat with this, considering someone as prominent as Serena Williams, a world famous tennis player, experienced childbirth complications when she gave birth to her first child. She was experiencing blood clots, again, after experiencing them earlier in the day, and expressed her concern to a nurse in the hallway who just brushed off her concerns. And luckily, she was able to get a different nurse to run some tests for her, and they were able to basically catch her symptoms before her condition worsened. So I think that especially in healthcare, I mean, it's one of those things where if you catch symptoms that people are experiencing and contributing factors early enough, it can be the difference between life or death with patients, and they have a better chance of survival if it's caught early enough. So in conclusion, I found that all three of these themes are what contribute to this growing trend of African American women either suffering complications from procedures that they're getting or illnesses, in extreme cases even passing away because of the treatment that they receive from medical professionals. I think that this needs to be addressed and acknowledged that no one should go to the doctor and fear, is this the day I'm going to die, because they're not doing their best to care for me. Or I see the statistics and I know what this means for people who look like me. I, especially since I'm an African American woman, this is alarming to me and scary to think about. It definitely discourages me from even wanting to start a family, just thinking that you could die from childbirth related complications and never even get to see your children grow up. So I think that this definitely needs to be a wake up call, especially for the Arizona Department of Health, because women, African Americans, and women especially make up a great population of not only this country but the state. And I think just in order for us to feel protected, heard, and seen, these concerns must be addressed, and that way we can make progress towards a better future to flatten this curve.